Good morning, everyone. I'm Megan Culliff, along here with Scott Michlin.
Good morning.
Morning.
It's week 52.
That's I know, and look, our calendar connoisseur is like already there.
I'm going to adjust this.
52 weeks, a year. Yikes.
That's about wraps it up, doesn't it?
That sums it up very nicely. Thank you.
Exactly.
I'm assuming that's our buddy, the English professor, Vicky Holmstrom.
Yes, exactly. And I don't know if you saw after last week's show, because you were only here for half of it, but she has a fan.
I bet she does.
On Facebook.
I'm not surprised.
Who called her out and said they enjoy every week when she gives us the weeks.
We do too.
And we do too. But I'm just saying, she's become her own entity.
I think she has watched all year.
Oh,
that's
I'm
how great she is.
Well, you can't turn away. Anyone who watches you and me, you cannot turn away.
Yeah,
you cannot do
you got
that.
to rubberneck your way through.
That's right. Anyway, we're glad that you were all with us, everybody, on week 52, and I believe this is show 113.
That is
that you and I have done together.
Does it feel like that? Does it feel longer than
that? Well, do you want me to answer that?
Nope.
Okay. But anyway, I believe as we were keeping count, it is show 113.
Yeah.
Because, of course, if you recall, everybody, we started the show 4 days a week, and then we went down to 2 days a week, and then since January, we've been doing it on a weekly show on Thursdays, and we would so like to be put out of business.
I know.
And not do the show, but in the meantime, we feel it's important to do the show.
Yes.
And to share this important community information with everybody, and that's why we're here.
I'm humbly proud of what we're doing. Yeah.
Indeed. And today is no different. Look at this lineup. Look at these people.
Look at these headshots.
I know, right? Mike Mestis is going to be joining us in a moment here. He is, of course, the San Juan County Emergency Manager who helps coordinate all these things that we talk about, whether it's the testing or the vaccinations or all this stuff. And so we're so very grateful to have him on the program today. Also, a couple of local community pharmacists are going to be calling into the show. That is Ashley Seaforth from Care Drug in Aztec and Bloomfield, and Craig Burgess from the Pinion Family Pharmacy in Farmington. And then we're going to be talking behavioral health with Christine Carlson from Tota Behavioral Health.
It'll be an important show.
So we're looking forward to all that. Some great guests on the program. But maybe the biggest news today has to be, and neither one of us are wearing the color. I thought about it, and I forgot to wear green today.
Oh, you should have told me. I could have wore.
Right?
I got a nice green blouse.
San Juan County is all I saw yesterday afternoon. Green, because we are in green, everybody. So congratulations. Again, the 2-week update to the map. The state uses the numbers of positivity rates and the numbers of positivity rates, as I mentioned, and other criteria to determine if we're moving from red to yellow to green. And so 2 weeks ago we were in yellow, and now today, as of yesterday, we are in green. And so again, take a look. Our cases per 100,000 is down to 5.8.
Nice.
And our positivity rate is down to 1.55. If you remember, right, the controversy over the 5.001% or whatever it was.
0.05 or something.
0.01.
Yeah.
Yeah, it was very small. So anyway, that was just a couple of weeks ago, and we missed moving into the yellow 4 weeks ago, and now we're at 1.55.
Yeah.
So, and then the next goal will be the turquoise level, which a couple of counties are already in New Mexico as we look back at the map. And so, again, we are moving. But as we look around, you can kind of see that even Bernalillo County, the home of Albuquerque, is not in green.
Yeah.
They are still in yellow.
Yeah.
And so, but San Juan and McKinley, kudos to McKinley County, have had some very high numbers.
They've been struggling.
Are in green as well, just to our south. Rio Arriba to our east is still in yellow. And so there are other counties that are, as you can see, one county still in the red, but that's over on the eastern side of the state. And then some of the turquoise counties on the far northeast corner and a little bit further south of us are some of the more sparsely populated counties that have made it to turquoise.
Yeah.
But I think that's where we're headed if we all keep pulling in the same direction. Yeah. So we're very excited about that. Of course, what green means is still, again, no gatherings of more than 20 people. Retail, houses of worship now move up to 50% capacity, so good news again for churches and stores and things like that. Close contact, outdoor recreation, 50% of capacity. Indoor dining now at 50% of capacity. I know restaurants are excited about that. The weather's warming up, so outdoor at 75% of capacity. And even some of the indoor recreation, large entertainment can open at 25% capacity, and that would be things like movie theaters and things like that. And so we're not sure. I don't believe the Allen Theaters have made any announcements yet of their opening plans. I think they're concerned that they maybe need to have about 50% capacity.
Right, to justify the overhead.
Right. And that's the turquoise level, I believe.
Yeah.
So if we can get there, that may help the theaters. But in the meantime, some of these other things are opening up. I think the casino is opening up. And I think the Navajo Nation casinos are opening up for Navajo Nation residents only and staff.
Okay.
And we'll talk about that in just a moment. But anyway, that's where we are. So kudos to everybody.
Kudos.
It's not even St. Patrick's Day and we're green.
When is St. Patrick's Day?
The 17th.
Oh.
March 17th.
You're saying
it's every year.
You know what the actual origins of that is?
Snakes.
That's right.
Yeah.
Ridding the snakes of Ireland.
That's right. So let's
anyway
celebrate. Why wouldn't you?
Why wouldn't you celebrate?
Why wouldn't you? Exactly.
Listeners.
That's right. Exactly. A little shout out for the calendar queen.
Yeah, right? Calendar queen.
See? There you go. So anyway, shall we hear from our guests?
Let's do it.
Who are joining us this morning. And again, I want to give a little bit of background on some of these folks, if you don't mind, before we air the interview. And so we talked to them just yesterday, so very timely. But again, our guest this morning, Ashley Seaforth, she is with Care Drug in Bloomfield and Aztec. Vaccinations for the elderly. She was asked by the state aging and long-term services to vaccinate underserved areas of the county. Hosted drive-through clinics for folks 75 years and older in Aztec and Bloomfield areas, and getting out to help folks in Blanco and Navajo Dam, and is also helping to vaccinate homebound senior citizens. So that is what she has been doing. Craig Burgess with Pinion Pharmacy in Farmington, helping the community with vaccinations for senior centers. I was going to talk about that. Also working with aging and long-term services to serve elderly, vulnerable populations, and has been going around to help get vaccinations at senior centers in Farmington, Bloomfield, Blanco, and Lower Valley in the Kirtland and water flow areas. So those are our guests coming up this morning.
Yeah, let's hear them.
Here we go. Joining us now to talk a little bit about their efforts to vaccinate residents of San Juan County. Once again, joining us on the telephone, Mike Mestis is back with us, the Emergency Management Director for San Juan County. Good morning, Mike Mestis.
Good morning, Scott. Good morning, Megan.
Morning.
Also joining us from Care Drug in Aztec and Bloomfield, Ashley Seaforth is on the phone with us this morning, the pharmacist there. Good morning.
Good morning. Thank you for having me.
You bet. Great to talk to you as well. And Craig Burgess is joining us from Pinion Pharmacy in Farmington. Good morning to you.
Good morning. Yeah, thanks for having us this morning.
You bet. Well, we know all three of you are very, very busy, so we appreciate your time as well this morning. So thanks very much.
Thanks for coming in, guys. So let's talk about the Johnson & Johnson vaccine. That's kind of the freshest news. What is going on there? Have you guys had that come your way yet? What's the timeline? Go for it. Whatever you want to say about the Johnson & Johnson vaccine.
Ashley, I'll go ahead and defer to you guys.
All right.
Sure.
Ashley, why don't you start for us, please?
Well, I will tell you that Johnson & Johnson is going to be delayed here in our county. The reason for that is, our numbers are showing that we're pretty well vaccinated. because that is a one-dose done kind of deal, the state as well as the federal government have basically told us that they are trying to get that into the arms of people that are less likely to return and get their second doses. So those are going to areas where they are not getting the vaccines into people as quickly or as promptly as wanted. So I don't think we're going to see it for a little while. There is some news that New Mexico may be gaining some access to Johnson & Johnson in the next couple of weeks, but we're waiting to see that.
Got it. Thank you. Go ahead.
I'll speak to that as well. On our emergency management calls, they have discussed sending that to rural New Mexico because that population is underserved, and not that we're not going to get it as more doses increase for New Mexico, just that they wanted to get those initial doses to those underserved communities.
Very good. Thank you, Mike. And let me ask our pharmacist, too, Craig Burgess, let me start with you a little bit about the logistics, because as Mike Messis just mentioned, having just to get folks into a place to get one vaccine is probably a little easier than getting them to come back for a second. But logistically speaking, how has it been just getting your customers to, I guess, register and then coming in for their appointments and then hopefully coming back for their second dose? Craig Burgess, can you start with that answer for me?
Yeah, absolutely. So I've actually been pretty surprised about our customers coming back in for a second dose. I think there's a lot of anticipation about, having the vaccine, and in the last year, all the stress that has come with COVID. So I've actually been pretty surprised about how easy it's been to get, patients to come back in for the second vaccine. I think a lot of that is because the state has done a really good job with the online platform that they've implemented. That's the vaccinenm.org. And so they do a great job reminding you of when that second vaccine is. They send out text messages, they send out emails, so they do a pretty good job, of letting patients know about when that second vaccine is. So, overall, I think the response has been pretty good. Patients don't want to miss that second dose because I think they're worried about, getting another appointment in order to get it.
Great. And before I ask Ashley another question, do you have anything to add to what Craig just said?
No, I would echo that. I think that we're pretty surprised in how eager people are to get their second dose and have it completed, and it's almost like they bring maracas when they come. They're so excited.
I would like to see the maracas. I think Scott did that, but...
Yeah, when I went, yeah.
Yeah.
So,
Ashley, the whole band came. Yeah. So let's talk about the events that you've been putting on. There was one between Aztec, Blanco, and Bloomfield for folks that were not registered. Talk to us about that.
Correct. I think that we really tried to reach a population that, 75 and older is a hard population to reach out to. There are different ways and means of doing it, and community word of mouth is, can be exponentially helpful, telling grandmas and grandpas and aunts and uncles about it. And so we really tried to drive those two events. We actually did two of them, one in Aztec and then one in the Bloomfield area. For 75 and older, no registration needed. It was to basically try to touch that population that doesn't have access to all of the fancy millennial tools, to get them vaccinated. And it worked really well. And they all, I would say, our no-show rate for the second doses, because that population's already been done now. We only had 6 out of 250 not show up. So it was exciting to do that and operate that for them.
Indeed. And do you think, for both of you, Ashley and Craig, will we see more of these types of events to reach these populations, or do you think you've done a pretty good job of getting the shots in the arms of these folks? Ashley?
Well, I can start, yeah. So I think we're doing a good job. But there's always people that are, as we progress through the vaccine, are going to change their mind over time and, want to have access to it. Right now, our team is in an entire month of second doses. So first doses are going to be very limited through Care Drug at this point. However, we have been asked, and we're going to do another massive clinic for those patients. We're actually, if I can plug it, I guess, to say that. So on Saturday, March 20th, at the Fred Cook Stadium behind Kugler Middle School at 9 o'clock in the morning, we are going to be servicing all education staff, caregivers, care workers, child care workers, and then 75 and older. The state has guaranteed me quite a sum of doses in order to put on that event. And so that too will be a no registration required. We're very efficient. We did over 100 vaccines in an hour. So our team's got it down pat, and we will service this population once again without registration.
Very good. And Craig, anything to add about future events?
Yeah, so this week we're actually doing our second round of vaccines at all the senior centers around San Juan County. Yesterday we did Lower Valley and Blanco. Today we're going to do Bloomfield. Friday we're going to do Farmington. So we're doing the second round there at those senior centers, which is a wonderful place to service those seniors at. If they have any questions, they're welcome to call those senior centers, or they're welcome to call the pharmacy directly. I know Ashley, she said that she's doing vaccines there at her pharmacies. We're doing vaccines here at our pharmacy every day, and we're taking, patients for their first vaccine as well as whenever they come in for their second vaccine. So I think if we can service a lot of these seniors in our pharmacies, like Ashley's pharmacy, if you're not signed up, you're welcome to call us. We'll help you through that process. Or you can just come into the pharmacy and we'll help you through that process. The state's really pushing to get those seniors vaccinated. So they've really emphasized, to help these individuals out. Like she said, they're not, typically tech savvy. So we're happy to help them in the pharmacy, walk them through that process. Administer carside if patients can't get out of their vehicles, or if they want, they're welcome to come inside.
Sure. And Craig, let me ask you just a bit, from going out to these senior centers, the reaction that you get from the seniors who are there, who maybe thought they'd have to go to a pharmacy to get the vaccine, and here you are showing up where they are instead of them coming to you. What's been their reaction?
Oh, it's so exciting. It's great to see the smiles on their faces. Some of them even tears in their eyes because they're excited that they get to go visit grandkids and see family, and, integrate back into, the normal life that they are used to. A lot of these seniors really depend, on communication with others and getting to see family. That's the highlight of their life. So, whenever you get to give them a vaccine that allows them to do that again, it's wonderful. And, a big shout out to a lot of the volunteers that show up to these events, because I'm just a small piece of the event. Really it's the volunteers, the directors of the senior centers and their staff, and the county staff. They should receive all the applause in these events, because they're doing all the hard work.
Yeah, really is amazing and touching. Even,
right.
I think
I can imagine to hug a grandkid after a year. That's amazing. So
yeah,
great job.
So this question's for both of you, but we'll just start with Ashley. But what about registering through the state website? Is that how you guys are receiving your vaccine candidates, should we say, or are you just working off of your own customer base? What, aside from the events where you just show up, are people still registering through the state?
So for us, we operated on the state registry, the portal, for a few days and found it very cumbersome. Our work staff, our flow in the pharmacy is very efficient, and it really bogged our workflow down. We're not only doing shots during the day, we're also servicing our normal customers and patients with their regular prescriptions and taking care of them. So We actually switched to a different system, and it has been a lot more efficient, efficient in getting our population served here in Bloomfield and Aztec than what we found with the registration. So if you go to caredrug.com, we actually have a form there. You populate it, and it is based on, what the governor has released and who we can vaccinate. And we hired a scheduler. She works with us, and she gets everybody scheduled. As you know, these doses are really finicky. We have to have basically 10 people lined up in order to open one. And it causes a lot of grief on our staff if we don't want to waste a dose. That is absolutely the last thing that we want to happen. So this has made it really nice in a sense that if we have somebody that for some reason doesn't no-show, which I will tell you does not happen very often, but if for some reason we can go to that list and start calling people in, and that's what we're doing with our second doses as well. So we actually are operating off of our own system, and it's worked really efficiently. Our scheduler, calls you, reminds you of your second appointment, and we're just getting our service, our communities cared for the way that we feel it is best.
Very good. Craig? Same thing?
Yeah, so I'm using the Department of Health scheduling tool. We found it to be efficient. I just think, maybe we service different populations. But yeah, I would encourage people in the Farmington area to go on to vaccinenm.org and sign up. They'll get a confirmation number. And then they're welcome to call in if they do qualify, and we will schedule them into our system. Our, patients that normally come in, we can schedule them whenever they come in to pick up their prescription or if they call in. But I found it to be pretty efficient. I think that's one of the big reason why New Mexico has done such a great job of, getting these vaccines out is because of the tools that they are using. A tool for us might not work for Ashley and her pharmacy. In her system might be, very efficient for her. But the important thing is that we're using these tools to get vaccine into the residents of New Mexico. And, I don't know if you've read or seen, but New Mexico is doing a really good job. So, yeah, we're excited to be a part of the state vaccine.
Great. And so let's talk about, there's some folks in efforts of nobility, I would say, have been delaying their vaccine because they've thought, maybe I'm a school teacher, but I'm only 45, and so down the street is 72. Maybe I should just wait my turn. What do you guys have to say to that? Is this a sign up and just to take it when they call you, or is there something to be said about pausing and making sure our more vulnerable neighbors get it? Craig, why don't we start with you?
For those people who have done that, I applaud them. But at the same time, if the state will notify you when it's your turn, and I would not get the vaccine because of these reservations. I would get the vaccine as soon as possible, because the more people we get vaccinated in San Juan County, the lower our numbers will be. The quicker we can get businesses open and hopefully get, the economy back up here in San Juan County. So I would say, as soon as it's available for you, I would say take advantage of it.
Great. And Ashley, do you have anything to add? And also, does your scheduler ever actually run into that where people are then refusing?
Pass out an appointment?
Yeah.
No, not really. I mean, just to go back just a second, we do advocate that people register with both the state vaccine registry and us, because like I said, during this month, we did almost 1,600 doses last month, so we are doing nothing but second doses. So we do advocate that people sign up with both of our systems. But again, I don't think we're really seeing that. I think we're really seeing people asking, why isn't it my turn yet? the word's gotten out that we are pretty well vaccinated in this county. We're starting to see people be really taken care of efficiently and getting those populations that have been allotted vaccines. And so what we're going to start seeing is more, well, when is it my turn? And that's the hardest question to answer for us in the pharmacy, because we are restricted to who's able to get it at this point. So yes, I completely agree with Craig. Everybody needs to sign up if they want it. The state will notify them when it is their turn, and vice versa. We are doing the same thing. And like I said, because we don't want to waste a dose, if for some reason, if they're signed up on our system and we have a dose, we've basically been instructed to not waste that dose. So we start going down the list of the most, eligible to get that dose utilized. But if we can't get somebody in there, the next people start popping up on the list. So, your turn may pop up quicker than you think, but you're never going to know unless you're registered.
That's a very good point. Well, thank you very much. And I would think that the reason that our county is so well vaccinated is because of the work of folks like yourself and Mike Mestis, who has been patiently listening to all this and who I appreciate for helping us put all this together. I know Craig and Ashley, and there are other pharmacists in the community too, Mike Mestis, who are helping to do this great work. And you called them heroes, and I agree with that they are really getting the word out and getting these vaccinations into people's arms that are kind of helping grandparents and grandchildren reunite and helping restaurants reopen and helping all these things that we want to happen. Kids go back to school and get back on the playing fields and all these things. But I know, Mike Mestis, you want to say a couple words about these guests and other folks in our community.
Yeah, definitely. As you and I have spoken about, these two folks, Ashley and Craig, are definitely my heroes because they're helping our community in addition to PMS, San Juan Regional, Walgreens, and Walmart. As I've spoken about in the past, it's a community-wide effort, and if we don't divide and conquer and we leave all the work to one agency, then it's going to take a lot more time. But with efforts of these two and for me to be able to call Craig and say, hey, I have 3 or 4 first responders that need a shot, sure. Ensure that they're signed up, send me their names, and I'll go ahead and get them in. Ashley taking care of the east end of the county, and PMS is working on the west end of the county for school teachers. As we know, we got that conference from the PED this last week saying schools can go back to reentry by April 5th. So now there's a scramble to get educators completed. So with this community-wide effort, we'll get those educators completed.
Very good. Well, Mike, Ashley, Craig, thanks so much for joining us this morning.
Thank you all very much.
Thank you.
Thank you for having us.
Thanks for having us.
You bet. It's our great pleasure. And keep up the great work, everyone. Thank you so much. And there you go. Our guest this morning on KSJE. We appreciate them being with us.
Yes, always
Lots of great work.
encouraging news.
Right. Well, because we don't always think about the seniors or the shut-ins that can't get out. And so it's great that we're going to them.
Yes.
And by we, I mean them.
I was going to say.
The pharmacists.
Who are you going
and the
to?
medical folks. Yeah,
Yeah.
exactly. We have another guest.
Let's do it.
Right?
Go to the phones.
Let's go to the phones this morning because Christine Carlson is joining us. She is with Total Behavioral Health from Presbyterian Medical Services, and she is joining us on the phone this morning. Christine Carlson, good morning.
Good morning.
Thank you for calling in and being with us, and I always do full disclosure that I am a proud board member of Presbyterian Medical Services, so great to serve with that great organization. And we wanted to have you on to talk about some behavioral health and just to give folks maybe some advice and reassurance that they're doing okay, and hopefully you can do that for us.
Yeah, thank you for having me on. I know this is a very interesting and difficult time for people. There's lots of changes. We've had a year of kind of seclusion and then moving into all kinds of new things. And that can be really stressful. And I think the first thing that is really important for people to know is that if throughout the year you've had a little depression or your anxiety has been really high, that's normal. They're very difficult times. There are some things I think really to look for. If you've noticed like a significant increase in your drinking patterns, Say, for example, you're somebody who normally has a drink occasionally with friends. You find yourself drinking at home by yourself every night. You may want to consult with a mental health person just to sort of check in and see how you're doing. Or if you're experiencing excessive anxiety or excessive depression, for example, you're sleeping all day and you've just sort of stopped changing your clothes and your PJs nonstop, you might want to check in with somebody and just sort of see how you're doing. Look for that extra support.
Yeah, that makes sense. And, let's talk about specific things that we can do intervention-wise. So one of those things is, of course, to seek support, like you just mentioned. What about things that people can do at home?
So that's a great question, Megan. I think there's a lot. First of all, I think it's important that you stay in contact with people you are close to. And I know that we're now looking at different ways of doing that, but picking up the phone and calling someone, I think, is great. For people with smartphones, we have all kinds of options to see someone. I know one of the things I've started doing is I have a weekly duo call with a friend of mine, and we both do our stationary bikes together. So it's like we're working out together 100 miles apart. So if you can do any of those kind of things, just talk to someone, fight that urge to be isolated, I think is really, really important. I think also monitoring your sleep habits, trying to stay on a schedule, which if you're somebody who's had a work schedule for, years, and then this year it's sort of hit and now that's changed, trying to maintain a schedule is really good for your mental health. And then some of the stuff, you hear all the time, but is very, very true. Eating right, trying to stay healthy, making sure you find a way to get some exercise can really make a difference.
Great. That's great advice. And Christine, I wanted to ask you too a little bit about maybe some folks who don't feel they are having difficulties, but maybe their family members or friends believe that they are. Is there any advice to try to, again, gently talk to that individual about some of the things that folks are maybe observing about them, the sleeping, the clothes, the what have you? I know that's always a sensitive topic to bring up, right?
Yeah, absolutely. But it's a great topic to bring up. There's always this fear that if you ask somebody how they're doing and they're not doing well, it will make it worse, and the opposite is true. It can mean a lot to someone struggling with depression to hear that you care about them, that you've noticed that they're off a little bit. So really start, I think, by reaching out first and talking to that person, offering them support. If you're unable to do that, I think you've called them, you've reached out, you feel like you still have concerns and they're not responding. It's appropriate, I think, at that point to talk to a mental health professional to see if you can get some assistance. I think it's also good to provide people with resources. So if someone's been a little depressed, they're not acknowledging it, you can still say to them, hey, I know that there's this New Mexico hotline. Let me just give you the number.
Yeah, that makes sense to me. So we are in the green. We just celebrated that recently. Actually, this morning we celebrated that. And so this means that we're going to be slowly re-entering. Now, we've had an entire year of establishing new habits by force, basically, by accident. It's not like we wanted that. So let's talk about re-entry now that we're going to have to go back to work in person, try to socialize again. What are some tips for re-entering after we've established these new habits?
Yeah, it was great to wake up green this morning, I have to say.
Yeah.
I think first be kind to yourself, right? Know that you're probably going to experience anxiety or some moodiness maybe in situations that normally wouldn't make you feel a little uneasy. That's kind of a normal. I would say don't overdo it. I know that there's a desire to immediately run out and go absolutely every place you haven't been in a year. Take it a little slowly. And really, as much as you can, reconnect to your support systems, people who have been supportive of you, and some of the same things you do at home, right? Reestablish your routines, those types of things. And I would really encourage people, too, when you can, to get outside some. Just being outside can really be therapeutic.
Indeed. We have such great places to go outside in this community for sure, in this whole region of the country. And Christine Carlson, I wanted to ask you too about kids, because we're hearing, of course, about sports is coming back, practices, maybe some other group events for kids to do safely. Is there any advice that you can give maybe to kids or parents of kids to help them re-enter into some of these activities that they've missed for multiple months?
Yeah, I think, support from parents is the most important support any kid has. So the more you can talk with your children about, this is what's happening, these are the changes to expect, this is how the world is, to have those conversations on a steady basis is wonderful. And I think, sports are very therapeutic for kids. Kids are by nature social, so being able to encourage them to do that in ways that still maintain safety for them, and kind of going over with them how they can keep themselves safe while still interacting with others.
Very good. And one last thing we want to ask you about is the FEMA response. That's big news too. So can you tell us a bit more about that?
I can. It's been very interesting this year. PMS has been part of FEMA's disaster response to COVID. And, normally with a disaster response, you're thinking like a flood or a hurricane, and it's kind of clear cut. And COVID has been very different. But one of the things that they've established is a hotline for mental health questions and issues that anyone can call. And it just puts you with a trained counselor who can talk to you specifically about the stresses of COVID. And is it okay to give you that number now?
Yes, please do.
Okay, so the number is 505-954-1057. And that's a statewide number for any COVID concerns. It's free, it's anonymous, and you will connect with someone trained in COVID counseling.
Very good. Well, Christine Carlson, we certainly appreciate you being with us this morning to share some of your expertise and great advice as we kind of move through all this together. As we're seeing, of course, it's been 52 weeks, a full year since this pandemic was declared. And so here we are, but we think we can see some light at the end of the tunnel. So thank you very much.
Thank you so much for having me and for all you guys have been doing for the community.
Thank you. Thank you very much. That's Christine Carlson with Totowa Behavioral Health Authority, our guest this morning here on KSJE. And we appreciate her being with us, and lots of good information. So
lots of good information.
There you go. We will kind of talk a little bit about some of the other numbers that we wanted to do. The numbers, of course, that got us to green, which is certainly important to share with everybody. So let me get to those real quick as we go back through our lists here of what's happening. And so again, as we talked about, the vaccines that are rolling out, of course, and the registration continues, and then the national numbers. And Johns Hopkins, of course, has been tracking these for the past year, and so here we are. And so
here we are, Johns Hopkins numbers. So U.S. confirmed cases are now at 28,761,027. That's confirmed cases. The United States confirmed deaths are now at 518,459.
Right.
That is a sobering number, of course.
It is, especially, and again, the media does this. Of course, it's an anniversary, so they're doing this all week now, right? 1 year ago, what were we hearing? And, of course, the numbers were so very low and different, and we didn't know what we didn't know.
I mean, I feel like that 200,000 was kind of this number that we were expecting, and so, I mean...
But I think at this point last year, we had maybe 700 cases?
Right.
In the country?
Right.
So, yeah. And anyway, we don't anymore.
No.
In New Mexico, again, the numbers that came out yesterday, of course, and these are all from KSJE.com, and you're seeing the headlines on the scrolling line on the screen as well. 257 new cases in our state yesterday. That's 187,487 total. San Juan County had just 2 new cases reported yesterday. So again, we're excited to see those numbers so very low. 13,586 total cases now. 9 deaths in New Mexico yesterday for 3,839 total souls lost, and none of those were from San Juan County, so our number remains at 450. And an additional 1,526 recoveries reported yesterday from COVID-19. So we appreciate appreciate that number. Some of the other news stories that we wanted to share with you, again, the state numbers are there on our website, ksje.com. The Navajo Nation numbers are there as well. They had 13 new cases yesterday across the Navajo Nation for a total now of 29,900. One additional death across the Navajo Nation for 1,205. And that is the latest numbers there. 16,212 recoveries on the Navajo Nation.
That is
Which
an
is
encouraging
encouraging as well.
Yeah.
The other story, again, from the Navajo Nation, they had announced that some of their restrictions will soon ease a little bit on Monday, March 15th. They're going to a level orange that they have on the reservation, so that's obviously different from what's going on in New Mexico. But that would allow some more capacity with some more retail areas opening up, and some of the other things that they are looking at. But the details are on our website, of course. As I mentioned earlier in the program, I believe that allows, I know that allows the opening of the Navajo Nation casinos, but only to Navajo Nation residents and employees.
Right.
So that is the one difference there.
Right.
But I know a lot of those folks who've been out of work.
Right. I mean,
That's been
getting
difficult.
people back to work, as we just heard Christine mention, is going to be very
Right.
helpful.
And then the other big story that I wanted to pass along too was the state saying, and I think we heard this in the interview too, that they're trying to get the educators now, K through 12 teachers, early childhood educators, and their staffs vaccinated. And
Yes.
so doses are being made available to those groups. And of course, that's what our pharmacy partners, Mike Mestis, the Department of Health, all working towards to make that happen.
Yes.
As well, which is another massive
Huge deal. Huge
deal. Yeah,
Yes.
exactly. So there you go. San Juan County released the latest averages yesterday, so we can share them with you on the show this week. And as you can see, the red line, state of New Mexico cases, continuing to drop, which we're very grateful for. San Juan County numbers, that blue line at the bottom there, is continuing to drop. And the Navajo Nation numbers, again, the green line, continuing to drop very low, back to kind of numbers where we saw as early as October. Before things were opened up. So again, we're grateful to see those numbers back down. The other graph that we like to share with you, of course, are the San Juan County numbers in yellow and the average daily deaths in yellow, and that red line that we have said, which has been the goal. And take a look. That's why we're in green.
Yeah.
Because our yellow line has finally gotten down to that red line.
I mean,
I'm not a graph guy, but even I can see that.
so there's an
Yes.
X and Y axis.
That's right.
Yeah.
But that's where
I'm
we
not
are.
a really
And-
graph girl either.
And that's what we've been wanting to see. But you can see how very high it was just, got December,
Yeah.
right?
Yeah.
And so good job.
I mean, yeah, we had the winter wave that we were expecting, and
right.
so
And now we have to keep it down. And hopefully with the vaccinations and some of the other things that people are learning to
Yeah.
do, we'll keep it down.
we're on the way to herd immunity.
And that's the idea. That
Yeah.
is so what we appreciate. The watch list, which we always check on, there was one local case, which was Farmington High School, with 2 rapid responses recently. And so we wanted to just share that with you for that reason.
Yeah.
They are on the watch list, but nothing has been closed down, again, in San Juan County. So that's good news as well for the community. And then I think the other thing we can talk about is testing for folks who
Testing, of
still want to
course.
get tested. That is continuing out at McGee Park, the curative.com registration site, or 888-702-9042 at McGee Park. And they're open Monday through Friday, 8 to 3, Saturdays 8 to 2. And again, that's where you go to get tested. And that still is one of those criterias, right? As we move from red, yellow, green, turquoise, they're looking at some of those test positivity numbers. And so even the math would tell you the more negative tests, I guess, the better to bring those numbers down.
That's right.
So, and then if you're sick and didn't know you were sick, that test will tell you.
Yes.
Is the idea. So,
Thank you, Scott.
yeah, there you go. Well, we talked about that every week, and that's part of the issue. So that's how you get to the test, of course, from US 64 and exit onto County Road 5500
Great.
at McGee Park. Once again, the number that Christine Carlson mentioned, that FEMA response, if you do need assistance or want to reach out, 505-954-1057.
Yes.
And it gets you in contact with someone who can hear you and help
And
you.
advise you, yeah.
From throughout the state.
Do not hesitate.
Exactly. So there you go.
Good show.
Week 52.
It's been a year.
It has been a year. 113
New
episodes.
year.
And we will see you all next week, everybody,
Yes.
because we're going to keep going as long as there's news to share about our local community. We are committed to being here with you every week. So thank you for watching and joining us and for sharing. Have a safe week ahead, and we'll see you next Thursday. Bye-bye.